Greetings to everybody. My name is Princess Patty. I'm an RN in Canada since 2007, and I am an instructor in college right now. The reason I'm making this video is to help you out how to keep your face painting kit clean and how can you promote best practice so that there's a lesser risk of contamination and lesser risk of infection. My sources are medical surgical nursing books, my training in the facility where I'm working. These are best practices updated yearly, and my books on anatomy and physiology. I want to stress out that when we are doing face painting and adapting it to the current situation, it shouldn't be difficult if you are using or already doing the right technique. What we call is the clean technique. It is different from the aseptic technique. Aseptic technique is the technique that medical professionals use when we are using all the stuff, when all the stuff that we use are all sealed and brand new, and we are using surgical gloves. So these are not just clean gloves from a box, these are sealed gloves. And we are working on a sterile field, meaning it's like you're in surgery. So you're using aseptic technique. And we are not going to go in detail about that because we never use surgical level technique in face painting. We got to focus on the clean technique. Basically, clean technique means that you got to wash your hands, and you have to wash your hands every single time that you come in contact with any surface. I have to stress that. So before touching the person, before touching your stuff, for example, your face itches and then you scratch your face, you gotta wash your hands before touching another item or the person. So that's your clean technique, washing your hands in between surfaces. Washing your hand also means washing your hands with soap and water. We are trained that is the best technique. However, in some cases that we don't have access to water and soap, if your hands are not visibly soiled, then you can use disinfectant gels. So the alcohol gel, you can use that. Still though, we are promoting the use of soap and water for 20 seconds for washing and cleaning our hands. This part, I will be talking to you about when do we not face paint someone. So if we signs of infection, respiratory or skin infection, I wouldn't really start face painting. Signs of respiratory infection would be overall look of fatigue, you have cough, runny nose, body pain, like difficulty of breathing, phlegm, all those things. If you see those signs, obviously you can't face paint because the person can cough on you, you can get sick, and even if you have face mask on, or if the person coughs on your kit, then your kit is already contaminated. Skin infection wise, yes, if you have signs of infection, I'm not really comfortable doing face painting, so I don't face paint. What I meant to is that if you have discharge of pus coming out from an open wound, you have redness, you have pain on site, you have swelling, scab on the skin, because that is a compromised area, it's a weaker area. I wouldn't face paint on that. Any cuts or skin tears. One other area too is if I see pimples, I wouldn't really recommend face painting on it. It's because pimple is a sign that a pore or a skin pore is clogged and there is some reaction going on the skin and you don't want to irritate that further, so I wouldn't really recommend face painting on somebody who has pimple or acne. This is just a quick information about inflammation and infection. So inflammation does not mean infection. It is part of the infective process. So inflammation means that that site or that area has responded to an injury or a stimulus. It shows by increased heat, increased pain, increased redness, loss of function, but it doesn't mean that it's infected. So for example, I had a fall and I bumped my knee onto something hard and suddenly my knee is painful, it's swollen, it's red, it's warm, it's inflamed, but it's not infected. However, you would see signs of infection as discharge, pussy discharge, so yellow discharge with blood sometimes. You have redness on site. You have swelling on the site too and pain. And then, of course, you gotta have open wound. So an opening or a port of entry. So how do we practice the clean technique? First of all, we gotta wash our hands. Wash our hands 20 seconds with water and soap. There has to be friction too, so you have to give it 20 seconds and you gotta rub. For your supplies, for your brush, you have to use clean technique, meaning you're gonna use water and soap. And if you want to go and do this part, you can do two. You can add 1 part of hydrogen peroxide mixed in 1 gallon of water, and you can submerge your brushes right away and air dry them. Hydrogen peroxide is a chemical that we commonly use in wound care, and it kills bacteria. Old practices we can. When I was still in school back in 2000, yes, some of my teachers are using hydrogen peroxide, but since it irritates the skin and it hurts the patient, we don't use it as much. So we have other cleansers for open wounds. And okay, so hand sanitizer has to be 70% gel or spray. It has a drying effect on the skin though. You are more prone to breakage and irritation. So when you are using hand sanitizer a lot, you have to also protect your skin by moisturizing, putting lotion on your skin. Hand sanitizers or alcohol, they are irritating to the soft tissue. So soft tissue would be the skin around the eyes and your mucous membrane. So anything or any surface that is pink and moist and soft, it irritates the skin or the surface. Okay, so how about those pains? How do we do best practice to maintain or lessen the chances of contamination? Alcohol swabs in between use. So you can buy those small, you commonly used for glucose check, like when you're using your fingers for glucose check. That's what you use, and you swab your finger, wait a full minute, and then you start to prick. But this time you just use it on your kit and then wait for a full minute before using it onto someone else. I want to say that you gotta invest in sponges. So 1 sponge, 1 person. For the brush, like I recommend getting a water station or a wash station for them, and using that 1 gallon of water, 1 part hydrogen peroxide as a final rinse, second to the final rinse, and then you rinse with water and then air dry. Basically, that's what I want to say. It is also important to ask real quick if the child or whoever you are painting had an allergic reaction before. Are they allergic to anything? Basically, that's a basic question that we ask, do they have any previous reaction to paints or special makeup? I really hope that my quick tips help you and you don't get a certificate listening to this, but this is from a medical point of view, and this is how we prevent infection and contamination in our workplace. The problem too is that face painting doesn't have a professional regulatory board, so there's no check and balance. Like if I did something wrong when I'm at work nursing and I cause trouble, then I get investigated on. My techniques are reviewed, and I am referred to a reliable source, a textbook, to review and improve my practice. Like professional regulating board also ask us to pay a professional fee, and we get an actual license, and our abilities, our knowledge are assessed every year. And this is the difficult part about face painting. We don't have that. That's why I am sharing my professional knowledge on cleanliness, hygiene, and disinfection, and decreasing the risk of contamination. Okay, I'm just gonna add this, and this is the last part, the use of gloves. It's totally your preference if you want to wear gloves pushing carts, doing your chores, whatever. However, the rule for PPE or protective equipment, personal protective equipment, is that we wear gloves during our medical practice only when we are going to be coming in contact with bodily fluids, including feces or poop, blood, urine, drainage like tears, semen, vaginal discharge, and yeah, so anything that exposes you to bodily fluids, then you wear gloves. But it doesn't exempt you from washing your hands. So wash before donning the gloves and after donning or after removing the gloves. Do we use gloves for face painting? Sounds like a terrible idea, in my opinion, because it's hard to maneuver when you have gloves, and you're not exposing yourself to discharge or bodily fluids if you're following and being cautious about the rules about not face painting someone with an open wound and all that. So just my thought that I want to share with you guys. Best of luck.